Hello. So what we'll be talking to you about is most common complication happening after breast augmentation by silicone implants. When I say most common, this is one of the most common complications happening after the surgery, although it is very, very less common. In different literature, publication, books, the incidence of this complication is listed as less than 2%. In our practice, we have seen the incidence of this complication is actually much lesser, 0.03%. But still, this is one of the complications which can be prevented and should be prevented if the doctor and the team, the surgical team, is taking due precautions. What is this complication? This is something called as capsular contracture. So if you are considering breast augmentation by silicone implants, do watch this video because we'll be talking to you in detail about what is capsular contracture and how to prevent it. Hello, I'm Dr. Rajat Gupta, board certified plastic surgeon working in Delhi and using breast implants, silicone implants extensively in my practice. And here I am talking to you about the most common problem happening after breast augmentation across the globe. What is a capsular contracture? So let's talk about what is capsule. Capsule is a natural body reaction after any implant placed anywhere in our body. Whether it is silicone implants, whether it's implants used in plastic surgery or implants used in orthopedics or cardiosurgery or any implants, anywhere. So capsule is a normal body reaction which is desirable. But capsular contracture is undesirable body reaction. So what is this? So the capsule which is formed after placing an implant in the body is actually a thin, soft layer. But the capsular contracture happens if this layer becomes tough, hard, and very, very thick. It may be painful to touch. It may change the shape of that body organ and the implant as well. So, why does this capsular contracture occur? There have been a lot of histological studies which has conclusively found out that this contracture thing happens because of mild infection happening during or after the surgery. So this means what happens is there is an infection which happens during or after the surgery, and this infection is not that much that it will cause fever, redness, or may cause pus, but this is very mild, but the bacteria actually sits on this capsule and the implant. And this makes the capsule hard or tough. This also means that every endeavor should be taken so that this infection or capsular contracture does not happen. So, what all are the precautions which we take in our practice so that the capsular contracture does not happen? What I call this is actually a 10-point rule during the surgery. Before the surgery, we make sure that the patient is not carrying any source of infection, any tooth infection, any urinary mild infection the patient might have. That history is taken and we rule that out so that the patient is actually fit for surgery. And then we make sure that the 10-point rule is followed in every case so that the incidence of capsular contracture is kept to bare minimum. So, rule number 1, prophylactic antibiotics. So when the patient is admitted to our hospital and before we start the surgery, we give them injectable antibiotic with the aim that at the time of incision, the level of antibiotic in the blood is reaching at maximum. So we make sure prophylactic antibiotic are given to each patient so that the antibiotic level is there to fight any infection the patient might have. Second, we make sure that the breast and the surrounding area, especially the armpits and the undersurface of breast, these are two areas which are not cleansed properly, is actually scrubbed very nicely and cleansed properly before the surgery is begun. So, we make sure that all the zone around the breast is actually also cleansed properly so that there is no source of infection. The third point which we follow is use of nipple shield. Now what these nipple shields are, they are small tapes which are covering your nipples during the surgery. These are sterile tapes used during the surgery to cover the nipples. Now why this is so? Because the nipples have opening of lactiferous ducts or lactational ducts. These ducts may have some normal commensals organisms or bacteria which may also cause infection to the implant leading to capsular contracture. So we make sure that before every case of breast augmentation, we use nipple sheets. Now, fourth point. We usually prefer to use inframammary incision. Now, inframammary incision is not only aesthetically desirable because the incision is beneath the breast on the undersurface so that the scar is always hidden even if the patient is standing naked, but also it is a desirable zone to prevent any incidence of capsular contracture. Why this is so? The other option is periareolar incision, which is around the areola, but through this incision, we go around the areola and injure the lactiferous ducts. And I just mentioned the lactiferous ducts may have some organisms which can cause infection. The other option is armpit or axillary incision. Now, armpit or axillary incision is actually in that zone which has maximum chances of infection because of the sweat glands around it. Because of this reason, inframammary incision has been found to be the safest in preventing capsular contracture. Fifth point, prospective haemostasis. Now, what does this mean? Now, earlier, the dissection during the implant placement and making of pocket was done by a knife or scissors, and whatever bleeding would happen, that would be stopped by a cautery. Now, in this practice, what would happen is there would be some bleeding. Now, one should understand that blood is a culture media, and wherever there is any small collection of blood, the chances of infection are more. So what we now do is called as prospective haemostasis. That means we do the oil dissection by a cautery or diathermy. What does this mean? This means that we coagulate or burn the blood vessels in that zone before cutting them. That means we make sure there is hardly any bleeding during the surgery. This also helps in prevention of capsular contracture. Sixth, after we make a pocket, we make sure that we change our gloves, and we make sure that every time we wear a gloves are powder free. This is important because we want the gloves should be absolutely fresh and new while you are in the vicinity of implant, although I'll be talking about how we put an implant as a no-touch technique, but still the gloves should be changed and should be ensured that you use only powder-free gloves. Seventh, before placing an implant inside the pocket, we use something called as triple antibiotic betadin wash. What this wash does is, this wash is actually a mixture of saline, 3 antibiotics as well as betadine, and we wash it in the whole cavity so that the cavity is cleansed properly and the antibiotic reaches in the cavity where the implant is going to be placed. This helps in any infection which may happen later on. 8. As I said, we use a no-touch technique for placing an implant. How do we do that? Now, we use something called as implant funnel. What is this funnel? This funnel is actually a plastic bag in which the implant is placed from the box, and this funnel actually goes into the incision of skin opening, and we place the implant by pushing through this plastic bag. This makes sure there is no human contact with the implant. The lesser the human contact, the lesser the chance of infection. So implant funnel helps in reducing the cost of capsular contracture. We are the first ones in India to import implant funnel and use it in our practice. This usually adds a bit to the cost of the surgery, but is desirable because it prevents any problems later on. 9th, after the surgery is finished, we use some post-operative medications like antibiotics and capsular preventive medications for a couple of weeks after the surgery so that the incidence of capsular contracture is kept to minimum. And 10th is massage after the surgery. So after a couple of weeks of surgery, we ask the patient and teach them how to do massage on their breast so that the chances of capsular contracture is kept very, very low. So this is our 10-point rule which we follow in our practice to make sure capsular contracture does not happen after breast implant. Always make sure that safety is priority in cosmetic surgery. I've tried to answer most of the questions regarding capsular contracture I'm asked by my patients. If you have more questions regarding safety in breast implants, kindly write into us by an email or below this video by questions, and I'll be there to answer all your questions. Thank you.